In a world where carbs are your enemy, you need one man to help you fight your battles. That man is Jimmy.
Combating nutrition disinformation and general bull. It's Jimmy Rants. JimmyRants.com.
Nutritional Therapy Association. The NTA trains and certifies nutritional therapy practitioners
like me
and consultants by focusing on bioindividuality,
one size diet doesn't fit all,
and the range of dietary strategies that support wellness.
being healthy overall, y'all.
The NTA emphasizes a whole food,
Vegetables from our front yard and backyard gardens,
properly prepared,
like fermented and sprouted,
and nutrient-dense diet
like grass-fed butter and grass-fed beef.
as the key to restoring balance and enhancing the body's innate ability to heal. Throughout their programs, students learn a wide range of educational tools and techniques to identify and correct nutritional imbalances and deficiencies in their clients, and they launch a successful career in holistic nutrition.
And they might become best-selling authors and podcasters too.
The NTA produces like-minded practitioners and consultants that we consider the leaders in health and wellness.
Oh yeah.
Registration is now open for May classes, and you can learn more and save your seat by going to nutritionaltherapy.com.
Go sign up.
And don't forget to mention Jimmy and Christine Moore on your application. What's that website again, Christine?
Nutritionaltherapy.com.
Go sign up, y'all. You hear?
Oh yeah.
You're so silly. What's up, you guys? Welcome back to another Instagram Live, and we're here with another episode of Jimmy Rants. JimmyRants.com is the website, and if you're brand new to the show, here's how it works. The fun begins over on Instagram Live. You got to go follow me right there. I'm at Living Low Carb Man, LIVIN LOWCARBMAN. Once you're there, you can engage live in the content, just like all the people coming in right now. Thank you guys for being here. We also are over here on Facebook Live. Lots and lots of people watching here. Like my friend Kristen Berglund just came in from Sweden. Thanks for being here, Kristen. So if you missed the live, you can actually watch it on replay for up to 24 hours on Instagram. But after that, it does disappear. Pop on over to YouTube. You can see all the past episodes of this here show. Type in the keyword Jimmy Rants. You will find the show. Finally, the best of the best moments of this here show, they're in podcast form. It's the Jimmy Rants podcast over on Apple Podcasts as well as Stitcher. All of these links, you guys, are at JimmyRants.com. Today's Jimmy Rants is a question a lot of people ask me quite often when they write me an email. And I get hundreds of emails every single day, you guys. And one of the most common questions that I get again and again and again is, why does my doctor not understand keto? I tell him I want to eat low carb, moderate protein, high fat, ketogenic, and he looks at me like a deer in headlights. And I don't understand, with all my health markers getting better, with everything about how I feel getting better, I'm losing weight, I'm getting off of medications, I'm having all these really, really good things happening in my health. Why is my doctor still living in the age of the dinosaurs? And it's a great question if you don't understand what's going on. And I have a story I want to talk about here today, but the question that we're going to talk about as the subject matter of this Jimmy Rants is, why don't doctors share keto as a therapy for chronic disease? Because we know that most of the chronic diseases of our day, chronic diseases are things like diabetes, type 2 diabetes, heart disease, obesity, Alzheimer's disease, cancer. These are all chronic diseases, which, oh yeah, by the way, they're also all metabolic diseases. They're also all diseases that are related to your nutrition. And so when people go to see their doctor and they have symptoms of one of these diseases, what does the doctor do? Does he want to dig deeper as to, I wonder what all these symptoms are related to? No. what the doctor does is he tries to treat the symptoms that you're experiencing. He doesn't ever get to the bottom of it, which is why functional medicine practitioners are popping up and people are becoming more and more convinced that that's the way they need to go. So they go see a functional medicine practitioner who doesn't look to cover up symptoms. They look to actually physically heal the body and get to the bottom of why you're having the symptoms. So let me read this story and then I'll add commentary along the way. So this is out of NPR. Why do doctors overtreat? For many, it's what they're trained to do. When family physician Jenna Fox signed on for a year-long advanced obstetric, I can't say that word, obstetrics, obstetrics. Why can I not say that? Anyway, you know what I'm talking about. Fellowship, after her residency to learn how to deliver babies, she knew she'd need to practice as many cesarean sections as possible. The problem was she also knew that C-sections weren't always good for the patient. Many women's health experts argue they're often unnecessary and they increase the health risk for mom and baby. Doctors are working to decrease high C-section rates in hospitals around the country. Fox and her colleagues on the labor and delivery floor at the University of Rochester try hard to prevent them, primarily C-sections, when a woman needs one for her first baby. So she says, I want to avoid primary C-sections, but also in this 1 year of my life, I want all the primary C-sections in the world so I can learn how to do it. It's me feeling conflicted internally all day, every day. And during her fellowship, she says the more C-sections that she does, the better prepared that she'll be to practice independently. So as you can see, here is a medical professional in training, and she's wanting to see this stuff in action. And so they're performing more of this thing that she knows probably isn't as necessary as it's being done, and yet because she needs the training, they're doing them. Medical education is built on the assumption that the more procedures or treatments that doctors see and do, the much more competent they'll be when they're independent. It can feel tempting to do more of them rather than less. So if you're just joining us, I'm reading about a story that's explaining why doctors are so quick to jump to a pill, so quick to jump to treating a patient with a surgery. And the question we're addressing here is related to keto. Why don't doctors share keto as a therapy for chronic disease? And the bottom line on that one, by the way, is they're not getting trained. Could you imagine if they added in an actual nutrition course to medical school training? I know that there are movements afoot to make that happen, but the problem with it is whose nutrition are you going to teach? Is it going to be a mostly plant-based kind of mode of teaching? I don't want just plant-based to be pushed. Is it going to be a low-fat, high-carb mode of nutrition taught? I don't want just that taught. I think they should see the merits of every diet modality, what the metabolic effects would be, who would be good for doing a low-carb diet, who would be better if they didn't eat as much fat. I want to see all of that. That would be great. But the problem right now, you guys, is doctors aren't given any of that. And that's a shock to a lot of patients who go to see their doctor, and then the doctor's like, you need to lose weight, and the patient goes, well, how do I do that? And the doctor's like, low fat, I don't know. So that's part of this issue here. But excessive medical tests and treatments can have financial and personal costs. They contribute to this country's rising healthcare spending and subject patients to anxiety and the risks of extraneous procedures. A group of medical educators thinks that this epidemic of overtreatment, as they call it, starts with the habits that doctors develop during their training, habits they're hoping to break with new approaches to medical education. So as they're going through the training, you guys, these doctors are seeing procedure after procedure after procedure. And so it's kind of ingrained in their head. When patient has X symptom, you do X procedure. Or if a patient has this thing going on in their health, you give them this drug. And that's their modality. That's their mode of thinking. And I love it that they're trying to get them out of those habits of doing that. But the problem is, because they don't have any education in nutrition to speak of, and yet most of these chronic diseases that they're dealing with, and patients coming in with the ramifications and the symptoms of all these chronic diseases, they're treating the symptoms and not the actual disease. And I'm trying to put out a call to action in this Jimmy Rants here today. We need to actually be looking at how do we actually treat the disease that's causing all these symptoms. Because when you go to see your doctor, unless you broke your arm, that's not a nutrition disease. That's something a doctor can definitely help you put back together again. But when you come in with stomach pain, or you come in with other kind of metabolic symptoms, maybe chest pain, people don't think about that as a metabolic symptom, but it is. All of those things could be helped with a nutritional approach. And the problem is right now, they don't have the knowledge and the know-how that a ketogenic diet, for example, could be used as a therapy for treating this. And the big one, you guys, is type 2 diabetes. How many of you have had type 2 diabetes get completely reversed once you started eating low carb, moderate protein, high fat? Yeah, a lot of you. And so if a lot of you have gotten better on this very chronic disease that are being put on medications like Tic Tacs, and they're coming off of all those medications now, and they're no longer having to take exogenous sources of insulin and all the other things that they've been having to do to treat type 2 diabetes without actually helping them help with the disease. You've gone keto now, and you've come off of that medication. You feel better. Your A1C is down in the healthy range where you're no longer considered type 2 diabetic. Why, if all of that's true, and it is, why don't doctors know about keto as a therapy for that chronic disease? They should. And there's enough anecdotal evidence, as well as a lot of medical doctors that are using carbohydrate restriction. Now, it does help that the American Diabetes Association several months back now did finally put down that, okay, if you're a doctor, you can actually use low carb and ketogenic diets as a modality for controlling this disease. But it's been years of kicking and screaming and years of indoctrination telling patients that this is a disease of a deficiency in some drug rather than something that's happening in their diet and their lifestyle. There's some evidence that the patterns we learn in residency are hardwired for the rest of our careers. There was a study in the Journal of the American Medical Association in 2014 that found doctors who trained in regions where patients underwent more tests and procedures went on to practice independently, doing the exact same thing. So if your doctor is very procedure happy, test happy, doing surgery happy, popping pill happy, it's because that is how your doctor was trained in medical school and in residency. Do you ever stop to think about that? Why does your doctor act the way they act? They act that way because that's how they were trained. So let's flip the script. What if in medical school they got training in nutrition and they saw that the type 2 diabetes patients got their diabetes overturned eating a ketogenic diet, for example, and they took them off of medications and they basically got them out of diabetes. They cured them of their diabetes. And they saw that again and again and again and again and again in their training and in their residency. How cool would it be if, using the same principle of they practice how they were taught, if they were taught this early, they would go on to become a keto doctor and understand the value that keto offers. And every single keto doctor now, usually learned after being traditionally trained, but every single keto doctor now, the reason they use it is they've seen it work in their patients. And not every patient responds to keto. So even though they're a keto doctor, people like Dr. Ken Berry, Dr. John Lemansky, Dr. Will Cole, all of these guys that are practicing medicine, Dr. Adam Nally, and they're using a ketogenic approach, if there's a patient who does not get benefit from going keto, they're going to put them on something else, but they see the value for their patient population and the people that come to see them in putting them on a ketogenic diet. Could you imagine if in medical school they actually saw it replicated again and again and again and again and again, so that it became a part of the culture of who they are as a doctor? That's how we change this, you guys. That's how we can stop asking the question, why don't doctors share keto as a therapy for chronic disease? Right now, they don't, because they don't know about it and or they weren't trained in it. But what would happen if they were trained in it? What would happen if they knew about nutrition and they knew that the fats would feed the brain and the fats would be easily converted in carbohydrate restricted state into ketones, and those ketones would fuel the brain for patients with Alzheimer's disease? And they controlled their blood sugars very naturally, and they lowered their blood inflammation levels very naturally, and blood insulin levels came down. Pretty spectacular if that happened. Academic medicine is often criticized for its emphasis on an overly thorough workup for ordinary problems. In the name of learning how to practice medicine, young physicians may be tempted to order lots of tests, a trial and error approach with real implications for patients. Have you ever been to the doctor and they seemingly run test after test after test, and you as the patient, you think, okay, all these tests are necessary. And what you find is a lot of the tests they run aren't necessary. Here's the thing that gets me though, you guys. In this wanting to whittle down what tests are necessary, they're actually eliminating some tests. My doctor, who I had to fire last year, refused to run fasting insulin. Now, you guys know, because I talk about this quite a bit in my work, I am still a very insulin resistant man. I have belly fat and I'm trying to watch my fasting insulin levels. He stopped running fasting insulin. And when I asked him why he wouldn't run it, he said, oh, you're not a type 2 diabetic. I'm like, I'm trying to prevent type 2 diabetes from happening. And I like to keep an eye on my fasting insulin. Please run my fasting insulin. He refused. So I said, you're fired. I can't put up with that. I need to have the test I need. So I think, and he's an older doctor, so I think what we're seeing is in med school, and when they're fresh out of med school, they're doing the let's throw everything in the kitchen sink at you test-wise. And a lot of those things may not be necessary. But what's happening on the backside of the careers of a lot of these doctors, like my doctor I had last year before I fired him, they're actually not running enough relevant tests. And here's the thing, it's because they don't know the value of a fasting insulin, because most of what they're doing to treat you isn't for the chronic diseases with nutrition. If it was nutrition related, a fasting insulin would be no-brainer. But because he wants to put you on some kind of a medication, that's not relevant to him. But you can bet your bottom dollar he is running a cholesterol test, because if I have a high cholesterol, he's got a pill that he can prescribe to lower that, and ostensibly by lowering cholesterol would improve heart health. It doesn't, by the way, but that's what he believes. And so this is kind of the system we're in now. Early on in my own training as a family physician, I remember ordering a colonoscopy for a young man who had mild rectal bleeding. I rationalized the risks of the procedure, bowel perforation, complications from anesthesia, because it would put both me and the patient at ease to know that his symptoms weren't caused by something that was dangerous. We like to be reassured. We feel so much better when we think a situation is terrible and then find that everything is awesome, rather than the other way around. Now, I'm all in favor if somebody wants to appease their patient's concern, because there are patients that are a little bit antsy about some symptom that they're seeing, and if you can run a test that will either rule in or rule out something, I think that's definitely a beneficial test to be run. But how many tests are being run that really don't need to be? But more isn't always better. It's not news that healthcare costs in the U.S. are out of control. We spend more money on healthcare per capita than any other developed country in the world. Can you imagine the savings we would have as a country if doctors were taught about nutrition and a ketogenic diet, for example, for a lot of these chronic diseases that they're currently treating with procedures and medications, how much money in the billions, tens of billions, hundreds of billions of dollars would be saved. Saved. And they're missing it, guys. I don't know how they're missing it. With all that we're hearing now about keto and other nutritional kind of modalities out there, I don't know how they can't understand that it would be a viable option for avoiding a lot of these tests, avoiding a lot of these procedures, avoiding a lot of the medications that are merely covering up the symptoms. That's where all the spending's going. That's where all the healthcare dollars are going. We could fix this pretty quick. Unnecessary tests and treatments may contribute to high costs. According to a 2010 estimate from the Institute of Medicine, we could reduce many of our medical interventions by 30% without sacrificing quality of care. And again, if they implemented a nutritional approach to a lot of these chronic health issues, it would go a lot lower than 30% down. We could probably slash most upwards of 80 to 90% of the current costs of care if we gave nutritional and lifestyle answers to things that we currently cut people up for surgically and give them pills for. And those pills don't come without costs, including side effects. There can be a disconnect between the abstract fact, however, and deciding how to take care of an individual patient, and that's the problem. There's a lot of doctors that they take this, I'm going to throw everything in the book at them to try to figure out what's going on, and then I'm going to be really aggressive at throwing a bunch of medication to deal with all these symptoms that I'm seeing. You got that kind of doctor. And then you've got a doctor that says, yeah, I'm just not seeing the value in doing all these tests. I'm just going to put you on 90 milligrams of Lipitor and get out of my office. So you've got both ends. That's how they act. Nobody went to medical school to treat the GDP, says a physician named Christopher Moriartes, who designs medical school curricula to teach appropriate use of tests. Well, Christopher Moriartes, we need you to teach nutrition and do it quick and understand it and talk about the hormonal impact of nutrition and talk about all the different kinds of nutrition. Talk about veganism, talk about Mediterranean diet, talk about a paleo diet, talk about a low carb, high fat ketogenic diet, talk about all of these modalities because guys, it's not a tool in their toolbox currently, but it should be. Doctors don't share about keto as a therapy for the chronic disease in their patients because currently they don't have the training. We need to add that training. Instead, medical educators are focusing on a different argument in an effort to teach judicious use of tests and treatments. It's the human cost of overtreatment. Order enough medical tests and they're inevitably going to yield abnormal results. So that's the problem. If you run enough tests, you might find something that's, quote, abnormal, but does that mean it's something that needs to be treated? That's the question. That's what these doctors are openly questioning out loud, trying to figure out. Doctors then may feel obligated to treat those abnormalities, even if the patient would have lived a healthy life without knowing about them. So, and let's not forget about misdiagnoses. Maybe you've been to the doctor, you have a family member that went to see a doctor and they were diagnosed with X. Everybody loves to be diagnosed with something. I remember Christine back in the day, she was diagnosed by that same doctor that I fired last year. She was diagnosed with fibromyalgia. Fibromyalgia is the biggest joke to be diagnosed with because fibromyalgia is this catch-all of we don't know what the heck's going on with you, so we're going to say you have fibromyalgia, and then they start putting you on drugs to treat the symptoms of what they think is a fibromyalgia. You want to know what it was with Christine? With Christine, it was low vitamin D. She had a vitamin D level which healthy range is generally considered somewhere between like 40 and 60, 60 to 80. There's a little bit of debate about what the level is, but definitely no lower than 40. Hers was 9. And so she had a 9 vitamin D level, and it was causing all of these symptoms that the doctor said, well, I think that's fibromyalgia because I don't know what the blank that is. And that's how medicine is being treated, which is why more and more people on a daily basis are going to see functional medicine practitioners. They're going to see people that can actually make you healthy, because that's what you want at the end of the day. Christine would still be suffering with that 9 fibromyalgia or 9 vitamin D and diagnosed with fibromyalgia, which, oh yeah, by the way, it also made her take Paxil, which was a panic attack drug. She was on Paxil for 10 years because he thought that she had mental health issues, and so he had her on Paxil. She had a vitamin D deficiency. And he totally missed it because there's no training in nutrition. There's no training in understanding the relationship between vitamins and your health and having all of those things in balance. And that's where we are, you guys. The doctors are treating the symptoms. They're not treating you, the patient, and what's actually happening. And they're being pushed into diagnosing you with something because here's the thing. With the healthcare law, the Affordable Care Act, they now have to put in some, what's it called, an ICD code. And in the ICD code, they have to have very specific codes that diagnose you with a named disease. Otherwise, insurance doesn't pay for all these tests that they're running on you. So they can put in an ICD code that identifies that you have X disease. And, oh yeah, by the way, patients like to have diagnoses of X disease. Oh, I have fibromyalgia. Oh, okay, yeah, I have fibromyalgia. Yeah, and I'm taking my fibromyalgia medicine. And I'm going to have fibromyalgia, and this is a medicine I'm going to have to take the rest of my life. It's crazy. It's totally natural to think more information is going to be better. Eventually, it leads patients feeling less well than they actually are if you uncover things that are meaningless but abnormal. And that's the thing. A lot of these tests, you guys, especially numerical kind of blood tests, they make it look like when you're, quote, out of range, that there's something wrong. And I'll give you a perfect example. The one that people freak out about the most is their total cholesterol. If you have a total cholesterol that comes in over 200, you've got on that piece of paper with your test results, you have high. It's probably in red and it says high. And you freak out. Oh my gosh, I have high cholesterol. Doc, what should I do about this? Well, let me tell you, I have great drugs that help you lower that. So then you take the drug and you start getting the side effects of the statin medication, the Lipitor, the Crestor, the whatever, and they're putting you on these meds because you see something that's, quote, out of range, and really it's not anything to be worried about. But people worry about their cholesterol. And so they put you on a drug to lower your cholesterol, and you're happy because your cholesterol goes down very obediently. Never mind, you have side effects, an increased risk of cancer, an increased risk of diabetes, and an increased risk of heart disease. Never mind those things. But you see a number go down, and I'm getting healthier. And we've seen some people die of their first heart attack because their cholesterol gets lower and lower and lower and lower and lower, and they didn't get healthier. This is the problem with the system. Take my patient with the rectal bleeding. After my overzealous workup, I talked through his case with a more experienced doctor. He told me what I now know from more clinical experience, that the patient's bleeding was almost certainly caused by hemorrhoids, and watching and waiting for a few weeks would have been safe and helped that patient avoid such an invasive procedure like a colonoscopy. Medical educators are now exploring ways to teach this concept early in medical education. They want to help medical students and residents curb these habits before they become ingrained. And if you came in late, we're talking about how doctors get into the habit of doing things that they were trained to do in medical school and in residency. And what they see is again and again and again running a bunch of tests, identifying some disease in the patient, and it's symptoms that determine what the disease is, and then they give them drugs to deal with the symptoms. And so I'm asking the question here, why don't doctors share keto as a therapy for chronic disease? They're not trained in it, but what if they were? What if they were exposed to keto as a treatment for a lot of these chronic diseases? How cool would that be? One area that seems to have some promise, harnessing doctors' competitive spirit and showing them how they compare to their peers. You know how they could institute competitive spirit? Is look at outcomes. Health outcomes. I can imagine the frustration of a lot of mainstream medical doctors where they're doing all the quote right things. And you as a patient, you've been in this situation before. You've been told you need to lose weight. And so you do all the right things. You cut your fat. You eat more healthy whole grains. You exercise on the treadmill every day. You do all of these things, and yet you're not seeing good health outcomes. What do you as a patient do if you're not seeing good health outcomes? You go find something that will work. And so you try the cabbage soup diet. Then you try this paleo diet. Then you try a vegan diet. And maybe you end up at the ketogenic diet, and finally all of your health and weight issues come under control. How cool would it be, you guys, if we challenged doctors? We want to see better health outcomes, regardless of how you get there. And regardless of the subsidies from Big Pharma and some of the other kind of things, if health outcomes was the goal for doctors, do you know a lot of doctors would be doing keto right now? And I think they do know. And if they didn't know, they would be investigating ways to do it. I think they're beholden right now to this thing called standard of care. And standard of care forces doctors to do things that they know aren't really going to help their patients. Standard of care says if patient has X on a blood marker, like a 200 plus on your total cholesterol, the standard of care says you got to prescribe that patient a statin medication. What if standard of care went away? What if that kind of standard wasn't required anymore, and all we're looking for is health outcomes? Give me the thing that's going to give that patient the best possible health. Johnny bar the door on keto at that point. That's what's holding doctors back from using keto as a therapy for chronic disease. Standard of care is a big bugaboo they didn't even talk about in this story, but it's a big one, you guys, that's keeping doctors quelched. Internist and Columbia assistant professor Joshua Galeras published a study in 2018 that examined the sheer number of tests that internal medicine residents ordered during the 2016-17 academic year at their residency program. They didn't distinguish between tests ordered on different types of patients, since all residents spend equal time in intensive care units as well as regular hospital floors. And what they found is that some residents ordered 7 to 8 times more tests than their peers. It's hard to say what number of tests is the right one, but this variability is concerning. In other words, they all got the exact same training, but some thought, oh, we need to test more and more and more and more and more. And then you had others that were more reasonable. So why the disparity? It's an interesting concept to see playing out. They're just trying to get their work done and making sure the attending is happy the next day. At Johns Hopkins Hospital in Baltimore, a group of professors is working to provide similar data to their residents in real time, with the hope that it would encourage doctors to think much more carefully about what tests are truly necessary. So let's see if there's anything else of interest here. So medical school professors are trying to use that spirit of competition when it comes to teaching students and residents. A physician named Lenny Feldman is hoping that report cards will help normalize more judicious ordering of tests. We have to break the cycle somewhere. I think where they could break the cycle bigger than anything, you guys, is to finally pay attention to nutrition. And they're overtreating, you guys. Doctors are overtreating patients because that's precisely how they were trained. They were trained to see symptoms in a patient and run tests to evaluate what those symptoms mean, to then diagnose said patient with some disease with an ICD code, and then to give them some medication or do some kind of a surgical procedure that would deal with said disease. That's the model. Keto can't come into play there anywhere because it's not even in the discussion. So if you're still in the mainstream of the medical system for chronic health issues, obviously if you break your arm, go to the ER, they'll put it back together again. But if you have type 2 diabetes, you have cancer, you have Alzheimer's disease, you have obesity, heart disease, these are all chronic diseases that are related to your metabolism. And if it's related to your metabolism, your diet and your lifestyle play an important role. Unfortunately, your doctors don't have any of that education, and they can't possibly help you. They'll give you a Band-Aid to cover up the side effects of what those symptoms of that chronic disease is doing to you, but they won't actually heal your disease. So I want to see what you guys have to say about this. We're going to go to Instagram Live first. We'll be over to you guys here in a minute on Facebook. Welcome in, welcome in. Thanks for being here on this episode of Jimmy Rants. Doctors don't believe they can learn from their patients. Well, Mary, that's not completely true. I do think that a lot of the doctors that are in the keto space, namely, I know Dr. Eric Westman, who was my co-author on cholesterol clarity and keto clarity, that's how he got into studying and researching and now practicing with patients a ketogenic approach. Is he had 2 patients come in, they had read Dr. Atkins's book and they lost weight, and he was intrigued. So I don't think all doctors don't believe they can learn from their patients. Some do. But there are some doctors that kind of take on the, I'm the doctor, I know all. And those are the doctors that usually burn out and quit before their time is up. Brittany says, doctors know what they were taught in medical school, which I assume is studies, influenced by drug companies. They're taught symptom management, but whole body healing. Yes. Symptom management is the big one, Brittany. They're not actually healing you. They're basically seeing that you have a gaping wound on your side, and they're giving you a little Band-Aid with duct tape. That's what they're doing when they give you a pill. And they're kind of covering up what's actually going on. An OD would most likely share keto before an MD. Did you mean a DO? Doctor of a DO. That's what Adam Nally is a DO, says LaRue. Yeah, I think there are certain doctors, chiropractors also would give a nutritional approach. Obviously naturopaths would. Any functional medicine practitioner, even if they are an MD. Christine and I are working with an MD who happens to be a functional medicine practitioner for some of our adrenal issues. We did the Dutch test recently and they came back really bad. So we're trying to get some of those adrenal things under control. And he understands that it's more than symptoms and it's more than diagnosing us. Sam says, my vet in West Virginia told me that they have 2 years of nutrition and doctors have less than 2 weeks. Doctors have significantly less than 2 weeks, sadly. Brittany says, I've never been to a doctor that asked me about my diet. They hear my symptoms and go straight to a pill to treat something. That's how they were trained, Brittany. That's why. Which is why I don't see doctors anymore, is what Brittany said. Well, I think doctors still play a good purpose in our culture, but it's not for the chronic health issues. If I break my arm, please put my arm back together again. That's what they're really, really good at. Unconventional Wisdom Keto says, I had no idea doctors were not trained in nutrition. There was nothing more frustrating, demoralizing than being told, move more, lose weight, see me in 6 months. Nothing provided in terms of empowerment because they can't. They don't know. What they will do is parrot the dietary guidelines, which we know are based on a whole lot of nuttin'. And so if the dietary guidelines are low fat, high grain, and they're not really going to help people, I think that's that abdication by doctors of the nutrition to those kind of powers that be. And don't get me started on traditionally trained dietitians. They're not given good information. They're given propaganda as well. Across the board in nutritional health, and in medical health. We need a revamping of how we're training people that's looking at patients. Mary says, when all you have is a hammer, everything looks like a nail. Have prescription pad, will prescribe meds. Yeah, that's pretty much true. I, for one, was told it couldn't work well. Poo. Talking about keto, Sam said. G Mama Webb, my endocrinologist, says lower calories and eat off of a lunch plate. Yeah, the smaller plates thing is always funny to me. So eat off of a smaller plate. I know there's research that says if you eat off a smaller plate, you'll eat less portions, blah, 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 blah. But I would want like 10 plates of food is the problem. I can't understand why doctors are so resistant to keto. I'm educating my GP every time I visit. He still focuses on the cholesterol. Well, again, I explained it here today on Conventional Wisdom Keto. They don't understand keto because they've not been trained in keto. There's a chapter in my book, Cholesterol Clarity, What the HDL is Wrong with My Numbers. Why are doctors so clueless about cholesterol? And they're clueless because they haven't been adequately trained in what's relevant on that cholesterol panel. They have been trained in looking at total cholesterol and LDL, and if you have high levels outside the range, you have a statin deficiency. So they put you on statins. Yeah, there's a lot that's it's a disconnect, and I think it would be easily remedied if just common sense would come into play. How do you find a keto doctor, says G Mama Webb. So I actually have a website that is a resource that helps you find a keto doctor, ketogenicdocs.com, ketogenicdocs.com. Doctors are stuck in the cholesterol heart hypothesis. Yes, Justin, they sure are. Katrina says, the first rheumatologist I went to for my lupus wanted me to follow a vegan diet. The rheumatologist I see now completely supports keto. He says, whatever I'm doing is working. And that's a good doctor, Katrina. Don't lose that one. They seem to be scared of keto. And maybe they are, Lisa. Partly, doctors, what they know about ketosis is in the context of ketoacidosis, which people in the keto world, they kind of come into keto, oh my gosh, I don't want to get ketoacidosis. And the first question I ask is, are you a type 1 diabetic? No, you don't get ketoacidosis. That's a type 1 diabetes thing. And that kind of relaxes a lot of people. Nutritional ketosis is not ketoacidosis. So how did you find out what it really was? What really was, Mary? I don't know what that means. Val said the docs told our neighbors their baby had leukemia and were going to do bone marrow transplant. A new doc tested for B12 and found he was deficient, no leukemia. Yep, that's Christine's vitamin D story all over again, except that's very serious because when you talk about a baby, people lose their minds and they're very trusting of the medical system. It's sad. My husband brought Lipitor home from his doctor and I threw it straight in the trash can. Alberto says it's interesting that many doctors are afraid of recommending keto, but not afraid of recommending vegan. Well, again, I think the powers that be that run a lot of the nutritional health organizations, specifically the dietetics group, that's what they're pushing people towards. So that does not surprise me at all. It's also scary that if the doctor knows how the body works, they should be able to know what food does. But the reality is that most of the time they study the chemistry of drugs. Yeah, doctors are good at two things. Physiology, so they know what happens in the body, and pharmacology. They know what drug to give you to deal with anything that's wrong in the body. The problem is there's a missing piece in there, and the missing piece is you don't live your life in a bubble. You live your life with food choices, you live your life with lifestyle choices, and the profound impact that both of those have hormonally on your endocrine system is totally missed by the medical profession. Vitamin D deficiency, says Mary. Got it. Wow, that's terrible. Alberto says biology is not an exact science as math. 2 + 2 always equals 4. Biology is malleable. So many body functions have not been discovered yet. Yeah, and in light of that, we need to act accordingly when we're doing treatment options for patients. All right, let me come over here to Facebook. Thank you guys for being here and your patience while I was talking to Instagram over there. Lots of hellos. Thank you for being here, you guys. I wish someone would have told me about proper recovery and rebuilding muscle, says Denise. Yeah. Tammy says, my physician husband tries to get patients on keto. Too many patients only want a pill. Tammy, that speaks loudly. And I think it's another part of the culture that the medical profession has passed on to the patient, because the patient is under the assumption, just give me a pill. They don't want to hear about nutrition because they've been told, we, the medical profession, have a pill for that. You know, you've heard that phrase, there's an app for that. In the medical profession, there's a pill for that. And so people come to expect it. And they think the pill will replace bad choices in diet and lifestyle. And it simply won't. And what your husband could do, and he's probably trying to do, is explain, okay, you can take this pill, but it's not going to mitigate all of the consequences of your bad nutrition. Why don't you clean up your nutrition, go have some bacon and eggs and an avocado, and call me in the morning. He had a patient find a different doctor, a diabetes specialist, because he wanted the patient to go keto to help his blood sugar. My husband is a DO, believes in not taking pills, but that is what his patient wanted. He teaches the residents that rotate with him the exact same philosophy, and it frustrates him to no end. I bet it does. That would be so frustrating, because you have the answer to lower their A1C and blood sugar and insulin and all the things to make their type 2 diabetes better, but they refuse. What do you do? Rose and Danny says, I reduced my A1C from 9 to 5.4. See? Powerful. Powerful. No medication, no procedures, just real whole foods. Kimberly said, I had one emergency C-section. The other one was planned. My body refused to birth my first child. I blamed it on my weight. The doctor told me it was just my body. How I would love to go back 15 years and try again. For a long time, I was depressed that I could not have my girls the right way. I'm often asked, are they healthy? My response is, as far as I know, I'm blessed to have carried them to full term and the knowledge to teach them better nutrition. Knowledge is power. Kimberly, I've seen both of your kids. They are two of the most beautiful, healthy looking kids that I've ever seen. So you're doing something right. Don't beat yourself up. Christine says, I need to get back on strict keto again. I've been off for 6 weeks since having a major surgery. At this point, I'm starting to feel better related to my recovery, but the massive amount of carbs I've been eating are making me feel awful. I'm going to get back on track. I lost 124 pounds on keto, and it's time to get back to losing again. Thanks for what you do to promote this way of life. Christine, you're going to do it. And if I can help you in any way, you let me know. My doctor put me on keto because she eats keto herself, says Nancy. Nancy, never lose that doctor. Never lose that doctor. Ann says, my endocrinologist removed me from her care just today, told me that my primary care doctor can manage me at this point. She said she rarely moves patients from her care and applauded me for fixing my diabetes. Good for you. I told her that if she had more patients that wanted to fix their diabetes with nutrition, tell them to do the ketogenic diet. I got a big old eye roll from her, just like when I told her that I was going to get off meds when I first started, and was removed from them less than 9 months later, starting with an A1C of 13.4. And that's sickening to me. You are exhibit A of a patient that took control of your health. You got your A1C, which was astronomically high, 13.4, that's pushing an average blood glucose in the 200 something. Average. And you fix that with nutrition. So for her to roll her eyes at you because you fixed your diabetes, but you did it the wrong way, apparently. Hello, Dad. Thanks for being here on my show. Louise says, ugh, so many tests, so many diagnoses, multiple medications, 7 really unhealthy, crappy years. Turns out I'm actually gluten intolerant. Yeah. I've been diagnosed with fibromyalgia before, says Kimberly. I took their drugs for a while. Nothing was changing, so I dropped them all, increased my vitamin D3 and K2, and now I feel better. I don't feel top-notch, but much better. And it'll get better the more that you stay on that medication or that supplement, for vitamin D3 and K2, and get sunshine, and you keep making the changes in your lifestyle, those things get better. Louise says you feel bad for so long when you get a diagnosis, you think finally now how to fix it. Now I'm not feeling crazy, except we don't need to fix. We need to know what caused it. That's where my doctor failed me. A lot of doctors, they feel compelled, again, by that standard of care and by the ICD codes. They need something to diagnose you with so that the insurance will pay for your visit. If they can't come up with an adequate ICD code, then some of the tests that are run, your insurance won't pay for it unless there's some ICD code that you have a diagnosis. The Band-Aids tend to have more side effects than the chronic disease. Robin, you are exactly right there. Our conventional professionals treat symptoms, very rarely look at the root cause. And Linda, that's something that I think could be easily resolved and fixed if in medical schools they taught them functional medicine, where they're actually looking for that root cause rather than trying to cover up symptoms. Drug companies own the med schools by the short hairs, and they want their agenda number one. Kimberly, that's true. That's true. And there's even something afoot, nutritionally speaking, with medical schools. There's this organization called the Physicians Committee for Responsible Medicine. It's a horrible group. They're just a vegan front group. And they have put together this little manual that they've now given out for free in all the medical schools that's basically vegan propaganda. And they're getting it into medical school students' hands as the way to eat for health. And again, if veganism works for you, go do your vegan diet and rock on. But the problem is that is a very myopic way of looking at nutrition as it relates to your health. And I think if they had a more organized, developed curriculum that showed them all the nutritional modalities and then let each one of them have their merits for specific disease states, that would be the way to do it. But currently, they're not getting even like a 3-hour seminar on nutrition. So when you go to see your doctor and you've got obesity, you should probably try to lose weight. Well, how do I do that? Cut your fat? They don't know. All right, one more comment over here. I bet her doctor did not believe that she reversed her diabetes because of keto, talking about the comment over here. The eye roll comes from the eye. The doctor fixed you with meds. I gave you eye roll, not keto. So guys, the bottom line in this Jimmy Rants is, why don't doctors share keto as a therapy for chronic disease? And even let's just throw any random nutritional approach in there. Why don't they share vegan? Why don't they share Mediterranean diet? Why don't they share paleo? Why don't they share any nutrition? And the problem is they weren't taught. They don't know. And you don't know what you don't know. And if you weren't taught, which is amazing to me because all of the chronic diseases of our day are metabolically related. Even cancer, guys. Even Alzheimer's disease. Type 2 diabetes, obesity, heart disease. They're all the same disease that are diseases of insulin resistance. And if we get the insulin resistance under control, which, oh yeah, by the way, keto helps with in spades, then and only then can we get the health back in order again. All right, guys, that's it for this episode of Jimmy Rants. JimmyRants.com is the website. As always, you can engage live with me over here on Instagram Live. Follow me at Livin' Low Carb Man, LivinLowCarbMan. We also simulcast live over here on Facebook Live. Thank you guys for being here. And stick around for the Jimmy Rants after party, which will commence as soon as we end the show on Instagram. If you missed the live on Instagram, you can actually watch it on replay for up to 24 hours. After 24 hours, poof, it disappears. But you can see all the past episodes over on YouTube. Type in a keyword Jimmy Rants, either in a YouTube search or a Google search. You will find the show. Finally, the best of the best moments of this here show are in podcast form. It's the Jimmy Rants podcast over on Apple Podcasts as well as Stitcher. All of these links, you guys, are at jimmyrants.com. So until next time, Instagram, we'll see you then.